Hi, welcome, Cindy. Please introduce yourself and introduce your school and program to us.
First of all, thank you for inviting me to present today. I'm Cindy Cush. I'm an assistant professor here at Loma University. This university is about 60 miles east of Los Angeles. So I'm coming from to you from a place that's a little warmer and a little less close to the beach. We're more in the desert. But Loma University is a faith-based university of about 5,000 students. So we're we're considered kind of a medium-sized campus, but we're a lot smaller than UCLA is. So it's a different environment out here than it is where you currently are coming from. But one of the things that we have here at Loma University is an accredited nutrition and dietetics program. It is accredited by Ascend, which is the Accreditation Council for Education in Nutrition and Dietetics. This council accredits several different types of programs in order to enable students to be able to take the boards to become a registered dietitian at the completion of their program. The kind of program that we have here at Loma Linda University is called a coordinated program. And this program coordinates the didactic or the lecture-based classes that are necessary for the knowledge that is needed. It coordinates that with 1,200 hours of supervised practice. The coordination of those two mean that you can apply to the program here, and we have several different kinds of programs, and I'll let you know what those are in a minute. You can apply once, and once you've applied to the coordinated program, then you are not having to apply to something else in order to become an RD, to become RD eligible, to be able to take the boards. So here at Loma Linda, we have two schools in the accredited program. We have the School of Allied Health Professions, that's who employs me. We also have the School of Public Health, but we are in the same building. But these programs are just slightly different, focused on different branches of nutrition and dietetics. So, first of all, I want to go back to the beginning and talk about what a registered dietitian does. A registered dietitian translates nutrition science into what is practical, what is actually actionable for people. So that means that there's a lot of research being done by, could be people who have PhDs in biochemistry or physiology, or physician researchers, or dietitian researchers who are producing the knowledge, but it's not in a form that the lay person can understand. So dietitians take that information that's out there in the knowledge form and puts it into practical terminology and teaches people what that nutrition science is actually doing, so that you can choose between blueberries versus Twinkies. So we used to call ourselves, and we still call ourselves, registered dietitians. The word dietitian is protected by a Title Act. So in order to be called a dietitian, you have to have gone to at least 4 years of an accredited program, gotten your 1,200 hours of supervised practice, and then taken and passed the registered dietitian boards. The problem is a lot of people didn't know what the word dietitian meant, that it was kind of this translating the science into what is practical. And most people were liking the word nutrition. Nutritionist is not a title protected profession word. So anybody can call themselves a nutritionist. But a few years ago, dietitians said, we need to make a change because people are not seeking dietitians for help. They are seeking nutritionists for help who don't have to have any kind of education to call themselves that. So we embraced the term nutritionist. So now we can, upon completing and passing boards, we can become an RD or a registered dietitian or a registered dietitian nutritionist. We can just call ourselves either one. So you will see both, but as long as it has the word dietitian in it, you know that there is a minimum requirement. It has supervised practice in it. So there's a degree requirement, supervised practice, and boards have been passed. So why are boards taken? Boards are taken to protect the public. In order to pass boards, you have to have enough knowledge and experience to know how to give an answer to the public that will keep them safe. So it is an important thing to have the registered dietitian or registered dietitian nutritionist credential behind the name. So in the field of nutrition and dietetics, there are three main domains, and they're all studied when you come to the program. One is in medical nutrition therapy, and we call that the clinical end. And that is mainly dealing with disease states. So people who have diabetes, type 1 or type 2, how do we adjust? How do we counsel them, educate patients so that they know how to eat in order to keep their diabetes under control? Or people who have high cholesterol levels, or people who have cancer, or people who have GI disease, Crohn's, celiac disease, ulcerative colitis, those kinds of things. How do they best eat in order to keep their diseases under control? So medical nutrition therapy dietitians are typically employed in hospital facilities or healthcare clinics, sites where they're dealing with patients who are already sick and they are trying to help them manage their disease process. Another domain is community or public health dietetics. And that is more on the prevention mode. How do you deal with the public and educate and counsel them so that they will perhaps eat in a way that prevents some of these diseases from happening in the first place? And then the third domain that we have is food systems management. So at a hospital or a school district, there are thousands and thousands of meals that have to be created every day for patients, for employees, for children that are going to school. So the food service manager is one who's going to take nutrition and make sure that the meals that are provided are nutritious. So there's menu planning, there's also a lot of budgeting, purchasing, and especially since there are so many people involved in food preparation, a lot of personnel management, behavior management, hiring, firing, that kind of thing. So all of those domains are taught within a program, a coordinated program in nutrition and dietetics. And because we do the supervised practice right along with it, we coordinate it together. The quarters that we're going over diabetes and learning about what all is involved with that, we also go over to the medical center, which is just a block away, and you actually see patients, live patients, and read their charts and start practicing how to talk to patients so that you are ready for practice whenever you finish everything. We're studying GI diseases. We go see GI patients. When you're in the community nutrition classes, you are doing an assessment on a particular group to see what is needed. And then a program is planned for that community group, and the students with the professor goes out to the community groups and they teach what is needed for that group. So with food service management, they prep food, and they learn how to budget and to plan the menu and to order the menu, order the foods that are needed. And then they do it for a large group of people. They cook for about 100 people every week during the first year that they're in the program. So all of these things are combined together so that when you get out and you take boards and you become an RD, you can choose what domain you want to practice in. And whatever you choose doesn't have to be for a lifetime. You could choose to go into food service management for a couple of years and then go into medical nutrition therapy, work in a hospital teaching patients for 10 years, and then switch and go and do something in the community. So all the skills that are needed are taught within the program, but what you choose to do with those skills really depends on what your niche is, where you find yourself to be. So we've talked about hospitals being a place of employment for dietitians. School districts are now hiring not just 1 or 2, but sometimes 3, 4, 5 dietitians to work at a school district, to not only make sure that the food provided for the children is nutritious food, but also to do some education in the classroom, which is a fun job. Public health departments are hiring. They have for many, many years. They hire dietitians to work in their senior centers with senior feeding groups, or WIC, Women, Infant, and Children programs. They have to learn some nutrition before they can get the funding to go out and buy what they need at the local grocery stores. Grocery stores are now hiring dietitians in order to help with messaging. A lot of times you'll be in a grocery store and you hear music played, but then sometimes there'll be a message that comes across that talks about kiwi, or where you can find legumes in the grocery store. So there are a lot of grocery stores, major brand grocery stores, that are hiring dietitians today. Prisons is another site. There are people who are incarcerated who need 3 basic meals a day, and they need to be nutritious also. And there are prisoners who actually get sick and go to hospitals. And so there are people who are employed with the state system and with the federal system in order to make sure that they stay as healthy as they possibly can while they're incarcerated. So there are lots of different kinds of places where people can work. People can also set up their own private practices and have a space or a home office where they can do online counseling and education with patients, or they can do it at an office itself. There are certain diagnoses that are covered under insurance programs that lead to reimbursement. If a private practice were to set up in a very wealthy area, there are a lot of cash paying people who come and will pay for nutrition counseling, one-on-one or in groups, or teaching culinary classes, that kind of thing. Education. Right now, a person is eligible to take boards at the end of an accredited bachelor's degree program in nutrition and dietetics. So that would be a coordinated program like we have here in Loma Linda. The other coordinated program that has opened up is University of the Pacific in California, in Northern California. And then USC also has a coordinated program. Right now, there are only 3 of us in the state where you only apply once and everything is packaged together. But there are other programs called didactic programs in dietetics, where 4-year degree programs are taught. But at the completion of those, you have knowledge, but you don't have to practice. So you have to apply for a dietetic internship, and that process is doable, but it's difficult. A lot of people finish a DPD and never get an internship. So I know I'm biased because I work at a coordinated program site, but I think it is the best route to go. But right now, people can enter here at Loma Linda as a junior and do their junior and senior year of college, graduate with a bachelor's degree, take boards, and then we have a BS plus MS. They can stay one more year and complete a master's degree. That would be the fastest route. So there was a sophomore here, and if they are considering it, they just have to have the prerequisites done. They can come here, do junior, senior year, one more year if they desire of a master's. The reason I say right now they can do that is because in 2024, in order to be able to take boards to be an RD or RDN, you will have to have a master's. So the Bachelor of Science program will continue here, but you won't be able to take boards until the completion of a master's. So 2024, that's the big year. So those of you who are juniors and seniors at UCLA who are considering taking a program here, a coordinated program, we have programs for you. We have an MS for those with non-nutrition majors. So people who have a major in chemistry, biochemistry, English, psychology, history, it doesn't matter what the degree is in, but it's not a nutrition degree. As long as the prerequisites are completed, and I'm going to go over those in just a second, as long as those are completed, they can enter into the Master of Science in Nutrition and Dietetics. And it's a 3-year master's because it concentrates at a master's level the nutrition knowledge that is needed for boards, plus the 1,200 hours of supervised practice. So we have an MS for non-nutrition majors. We also, actually, I told you there were 2 schools here. We also have an MPH, a Master of Public Health, for those who come in with, they can come in with non-nutrition bachelor degrees. So if they wanted an MPH, it would be more focused on the public health and community end of dietetics. If they wanted the MS, that is more focused on the medical nutrition therapy. But regardless of whatever program is chosen, everybody in the accredited program here at Loma Linda University receives everything that they need in order to be able to take boards. So if you have questions, I'm going to give you an email right now, nutrition@llu.edu, nutrition@llu.edu. You can send us an email, we'll get back with you, we'll connect you with the School of Public Health, or we will communicate with you through the School of Allied Health. So what are those prerequisites? You have to have general chemistry an entire year with lab, microbiology, a course, so a quarter or a semester with lab, human anatomy and physiology, a complete sequence, however it's taught. It can be A and P combined. It could be a quarter of anatomy and then a quarter of physiology, a complete sequence, college algebra or higher, a course in human nutrition, and then a certification of completion of a medical terminology course. So that can just be an online course. It doesn't need to be an actual collegiate course, but a certificate of completion. So if you email us at nutrition@llu.edu, we can get this list to you and help plan what you need to do in order to apply. We only have fall admissions in the School of Allied Health. And so right now our applications are open. They close May 31st, and that's for our fall admissions. I don't think any of you are in that boat this year, but the applications open November 1, and On the application, you say what you've completed, what you're currently taking, and what you plan to take, so you can apply before completing everything for the next fall. I'm going to show you a quick video, and then I'll have a little bit of time for questions, but here's a video.
Welcome to the coordinated program in nutrition and dietetics at Loma University.
We can't see it, Cindy.
I'm sorry?
We can't see it. You didn't share your screen.
Let me back up and start again. Thank you. Hold on, I'm having trouble. Okay, let's not do that. It was repetitive of what I've already talked about anyway. So right now I will just field questions if that's okay.
That's perfect. There are no questions yet in the Q&A.
Okay.
So we'll wait a little bit. If you guys have any questions, feel free to type it either in the chat or in the Q&A, and Cindy will be happy to answer. Okay, so are you able to stay a little longer? Oh, there is one question. Yay. So the question is, what are good opportunities for undergrads to get experience with RDs and dietetics?
Prior to applying in the program, I'm assuming, so kind of shadowing opportunities. I would go to if you think that you're interested in medical nutrition therapy, I would go to a hospital, I would call a hospital, ask to talk to a clinical dietitian, and ask if you could shadow for a couple of hours. Usually there's some volunteering process you go through and you're allowed to shadow. We don't require shadowing in order to get into the program, but it's always a good idea to follow someone around and see if you like that thing, that kind of thing. You could go to a school district. I say go to. You could call a school district and ask if you could shadow a dietitian that works there. It doesn't hurt to ask.
And I just want to remind everybody that we're going to have two professionals joining us shortly. You can ask them how they decided to go into this field and what type of activities they got involved in to make sure that this is the right place for them. We have one more question. How long is the program?
For those who would be coming potentially from UCLA, who already will have earned four-year degrees, they would enter the MS in non-nutrition majors. That would be a almost three-year program. Or they could also apply to the MPH, which is about 2.5 years. They're both about the same amount of time.
Thank you so much. In case you guys have more questions, please feel free to put into the Q&A, and Cindy will be around to potentially answer it. In the interest of time, I'm going to introduce our professionals who just joined us. Aleta and Ryan, thank you so much for being here today. And I shared with you a set of questions earlier, so we're gonna start off with those, and hopefully students will take over the questioning. But the very first one, please introduce yourself, your name, your title, place you work, and potentially tell us a little bit about your undergrad degree and explain some of those letters after your name. So Aleta, do you want to start?
Sure. So like Christina said, my name is Aleta Majorga. I'm local. I'm in Los Angeles as well. I'm the director of nutrition science for a supplement company called Smarty Pants Vitamins. You may know it's from very delicious gummy vitamins that we make, in addition to other ones. But so I mainly oversee the research and development and formulation aspect of the business. And I actually graduated with a master's degree from Loma University in the BS-MS track that Cindy had talked about earlier. My undergraduate degree is in economics from the London School of Economics, and it was a really interesting transition. But as she said, I completed those prerequisites, spent my 3 years at Loma Linda, and emerged with an RD degree or an RD credential from there. And it's been a really wonderful career, and I'm very happy to answer any questions that I can to help those considering it.
Thank you. Ryan?
Hi, everyone. My name is Wenn. I am one of the sports dietitians here at UCLA. I work with Olympic sports over in kind of the Acosta area, if you all know where that building is. And so I have a bachelor's degree in nutrition and dietetics from Fresno State. I did that. I did then my dietetic internship, and then I, at the same time of doing my internship, I did a master's at Northern Illinois University, as well as a graduate certificate in eating disorders. So I have some specialty in that area. I have a few additional letters after my name that I've accumulated over time. I am a certified specialist in sports dietetics. Just has to do with lots of sports nutrition experience. And then I also am a certified specialist in obesity and weight management from my time working in the outpatient setting. So we can talk a little bit more about that later, but that's kind of the gist of it. I've worked in a couple different collegiate athletic departments, and I love working with athletes and sports nutrition.
Thank you so much for the introduction. So we're gonna go on to the second question. What was your first job out of college, out of your MS? Because sometimes it's good to know what is the first type of job you can get after you finishing your degree. So who wants to start?
I can start. So after getting my master's degree in nutrition, my first job was actually in a hospital setting. So I worked in clinical dietetics and ended up specializing in critical care nutrition. So back to letters, the certification that I obtained from that was a CNSC, which is a specialist in critical care nutrition support. So effectively, calculating tube feedings and IV feedings like TPN. And kind of the little bit nerdy, but in a good way, aspect of, micronutrient calculations. And that was really where I got started and worked for most of my time. And then I transitioned over to dietary supplements after about 5 years working in a hospital setting.
Brian?
So I never worked in a hospital. I knew when I got into the field of dietetics that hospitals were not for me. I should rephrase that. I did work in the hospital during my internship, but as a professional, I have not worked in a hospital. My first job after becoming credentialed was in an outpatient setting. And so this was like a performance center, physical therapy clinic kind of situation where I was working with a multidisciplinary team. So we had exercise physiologists, behavioral health clinicians, dietitians, physical therapists, all in the same operation. And that was a really great experience as a young professional to get to work with those other providers and really learn from them. So I worked in that setting. At the same time, I actually had a side hustle private practice that I was seeing private clients, did like corporate wellness consulting. I had a couple of fitness clubs that I consulted with, private clients, things like that, to try and stay busy and keep my toes in different areas. And then eventually transition to full-time sports later on. But that performance center was a really awesome place because not only was I doing medical nutrition therapy, just in a different setting than the hospital, but I also got to work with eating disorder patients, sports performance, and a variety of clients in addition to like the general nutrition stuff.
Thank you so much. And as you can see, everybody, I gave everybody the option to speak out, not just to type questions into Q&A and the chat. So if you have any questions, feel free to raise your hand and I'm gonna get to your questions, or feel free to type it in the Q&A. My next question is, what steps did you take to explore this field and to determine that this is the right field for you?
I honestly, other than just a lot of research and talking to others who I knew were in the field, or I had connections to people who worked in nutrition, it was a lot of just determining whether it was a true kind of interest for me from just like an intellectual and an academic level. Having come from a different career prior to my master's, it really was about making sure that the kind of the objectives and the type of work that you'll do in this field aligned with my personal and professional goals, and my personality in general. So really it started with just a really deep interest in nutrition and wanting to explore it further, and then seeing opportunities with careers in nutrition that really aligned with where I saw myself in the future, and the ability to make a difference in people's lives and the ability to work with people in kind of a more of a preventative health setting. So it really appealed to me. But in terms of concrete steps, I never actually ended up shadowing anybody before enrolling in my degree. I just kind of went about, contacting people on LinkedIn and through friends, and just finding out more through my network.
So my journey in the area of nutrition actually started because I was an athlete in college. And I started out as an exercise science major, kinesiology, thought I wanted to kind of stay in that active people sports kind of situation. I didn't really know much about nutrition when I started as a freshman, but what I did know is that I was training more than 20 hours a week. I was, seriously strength training for the first time. We had a dining hall. I didn't know what to eat in the dining hall. Like I didn't know anything nutrition wise. And at the time, we had a consultant sports dietitian who worked 4 hours a week at our school. And so I ended up getting connected with her. I met with her. I started realizing how much nutrition made a difference in how I felt and how I performed. And I thought she had the coolest job ever and decided that I wanted to be here. So I have a little bit of a different story in that I knew exactly kind of what I wanted to do as a freshman, and it was more tailoring every possible project and assignment I could to sports nutrition and specifically what I was looking to do. And at the time, there were very few jobs in collegiate sports nutrition because of NC2A rules, and I won't get into that for the sake of time, but I was really lucky that a couple years into my career, they changed those rules and opened up the sports nutrition field dramatically. So I did shadow that sports dietitian. I started trying to do stuff in the summer, but during the school year, I was really busy with athletics and things. And so I didn't necessarily do a lot of shadowing or things like that, but definitely tried to do some research and learning about things online, and just like looking at LinkedIn or what colleagues were doing, future colleagues were doing, stuff of that nature.
I know we all wonder, what sports did you play?
I was a swimmer in college, swam butterfly.
Awesome. So next question.
Oh, I think you muted yourself.
Yeah, sorry about that. So next question, can you give a brief overview of your daily tasks and responsibilities? You have such two different career paths that this should be interesting.
Yeah, my job started out, so when I started working at Smarty Pants in research and development, I would say that my daily tasks looked very different, actually slightly different from what they look like now. And that's just a function of when I joined, it was very much of a startup dietary supplement business type of environment. And now the company's owned by Unilever. So it's a much more kind of bigger business and much more stratified, I will say, so a little bit more organized. But I will say the cliche thing that I think everyone says is that no 2 days are ever the same. I really go into every day with a plan and a to-do list, and some days I get through half of it, and some days I just add more things to it and don't even check the first thing off the list. By the nature of the business that I'm in, it's very rapidly changing. And so, especially with COVID in the last year, supplements have been kind of a wild ride. And just, we're always doing so much that I would say that, though, if I had to give at least like some descriptions, I definitely spend at least some part of my day reading academic journals, that like any new articles that may have been published that relate to micronutrients or micronutrient supplementation, looking for innovative technologies in this world. So any like supplement delivery format innovations that are out there. So I'll devote some part of my day to doing that. Definitely a big part of my day recently has had to do with just exploring the financial aspects of formulations and our cost of goods and things like that. So definitely having that econ degree come in handy as well. And so, it's really a lot of different things, but part of what I love about it is that no 2 days are truly the same, and there's a rapidly changing list of priorities.
Yeah, I laugh every time I get this question because it literally is. You could ask me tomorrow what a day is like, and it would be different than what today was. So, my responsibilities into 4 sort of domains or buckets. The first area is food service. So depending on your setting and where you work in sports nutrition, there can be responsibilities related to meals and snacks and delivery of that product. So for example, with some of our teams at NC2A championships, there's an element of me maybe not traveling with them, but helping coordinate meals and catering and things like that. We run things called fueling stations, which are sort of like grab and go operations where athletes can grab snacks. Sometimes we have something called training tables, which is like a more formal meal situation. So there's involvement in those sort of areas. The second area would be medical nutrition therapy. So, we do have athletes with particular medical conditions or things that they're working on. For example, I have an athlete, you can have an athlete who has diabetes or high blood pressure or food allergies, and you need a lot of those medical nutrition therapy skills to work with them, maybe in a one-on-one setting or in a counseling setting. The third area would be performance nutrition. So that's going to be specific stuff in regards to how do we optimize the athletic performance, the recovery, the durability of our athletes, what products do we provide, when, what's the schedule, et cetera. And then the fourth area would be education and research. And so as my other panelists said, in terms of reading articles and reviewing stuff, like that's going to be, trying to stay up on all that information, trends, trying to pay attention to what our athletes are looking at. That's a challenge in and of itself. And then also like mentoring and training interns and future dietitians in the field, and maybe partnering with researchers as well. So that's like the short answer.
All of those areas sound very interesting and very diverse, and that's what I like about my job too, that no 2 days look alike and no two students present the same questions. So I think that is the common trend here. So
You muted yourself again, Christina.
I don't know why I do that. I'm sorry. So what personality characteristics do you need to be successful in your field?
Oh, wow. I think I would say for dietitians in general, you sort of have to be personable and enjoy talking to people, but also have a very open mind. You know, people come at you with, you know, it's just true really in a lot of professions, but people will come at you with sometimes very strong views and convictions and something that maybe they heard on the Dr. Oz show, and it might not have, you know, a ground at all. And you have to kind of meet a person where they're at, in sort of where they think the truth lies with nutrition, and kind of work with them from there. And sometimes it takes a lot of navigating, but it keeps things interesting. So I think definitely open-mindedness, being a good communicator and personable and talking to people, but also having a knack for being analytical and being able to interpret science and interpret research, and enjoying doing that. Because as Cindy before had said too, like pretty much, especially in California where we don't have licensing laws, anyone can call themselves a nutritionist, and there are, you know, a ton of personal trainers and everyone that call themselves nutritionists after like a 6-hour online course. And that's not nearly the same as going through a rigorous program of education to become a dietitian. But you really have to communicate information that is based on science, that is backed by evidence. And so having that ability to interpret facts and deduce like kind of false information, that and kind of weed that out. That's important, but I could go on forever. I think those would be my top personalities.
I totally agree with all of those. I think part of our job as dietitians is to take that science information and translate it into practical recommendations for our clients or athletes or whoever that we're working with. So we have to sort of understand not only the research, but also how to communicate that, how to build rapport with our clients, or in my case, athletes. And then the other one that I would add would be adaptability and flexibility. I think this goes without saying in regards to what we were just talking about in terms of no 2 days being the same. You can walk into a session with a client and think you're going to talk about topic A, and they are, crying and they're struggling with something and they're really stressed about something, and the session goes in a completely different direction. So you have to be able to think on your feet, be flexible, kind of, be able to navigate those situations, and not be offended if you can't, do something exactly the way that maybe you had planned it out. I think a lot of dietitians are sort of type A planners to some degree. The degree varies. And while that can be helpful, you also have to be very, very sort of nimble and flexible. And getting comfortable public speaking and having conversations with people is a really important skill as well. I can't tell you the number of times that I'll have a staff member or a coach call me and be like, hey, can you show up at the field in 5 minutes and talk about X topic? And you have to be like ready to go. You don't have time to prep a presentation or a handout. So that ability to think on your feet and be flexible is very important.
So this was a piece of cake, right? All right. So my closing question always is, what was the most useful advice you've ever received regarding your career choice?
For me, it would have been not to settle, that it's never too late to do what you want to do. you know, that just having worked in a completely different field that I knew wasn't going to make me happy 10 years down the line, it takes a ton of just like determination and courage to pursue something different once you've kind of settled into a groove with a type of career. But if that's not your calling, and if that's not what is fulfilling to you, it's never too late to change. And it goes with like staying, you know, being open-minded about new opportunities and never closing those doors. I think that really always speaks to me and helps me kind of feel like, okay, I can really keep going. Like, I don't have to feel like I'm ever stuck in a rut somewhere. There's always another opportunity, and there's always something that you could be doing that you'd enjoy.
I mean, I think one of them would be flexible, but I don't know the exact saying off the top of my head, but there's a saying about like people won't listen to you until they know how much you care. I'm paraphrasing. But I think in my particular settings, and I think this goes for dietetics in general, relationships are very important, not only in a networking, you know, sort of way, but also with your clients and vendors and staff and whoever you're working with. And they're not, you know, if you're telling them to eat more vegetables, for example, they're not going to listen to that if they don't know that you care about them and that you take an interest in them and that you're building a relationship with them. So I think that perspective is important and always something to sort of keep in the back of your mind when you get kind of that tunnel vision and just want to help people. And sometimes you have to take a little bit of a step back.
Thank you so much for all the insights. So I am done with my questions, and we do have 5 minutes. I'm amazed that I managed to finish on time. So if you guys have any questions for our professionals, please feel free to drop it in the Q&A or in the chat, or just raise your hand, unmute yourself. And this is a great opportunity to find out a little bit more about nutrition and dietetics. Okay, we have a hand up. Go ahead, Alan, unmute yourself and feel free to ask your question.
Hi, I was wondering if you could talk more about the graduate certificate in eating disorders and like other type of specialties you can do in RD.
Great question.
Yeah, so the one that I have was specifically associated with Northern Illinois University, where I did my master's. And it was additional work in the field of eating disorders and behavioral health. And at this point, actually, the program is entirely online. It was not when I did it, but you can definitely check that out. EDOC is kind of the abbreviation, EDOC. And that has proven invaluable for me in all of the settings that I work in. The other certifications, so our like governing body, the Academy of Nutrition and Dietetics, the credentialing agency there has a number of certifications. So we've mentioned a few, the sports dietetics one, there's renal, geriatrics, nutrition support, diabetes. What am I missing?
Pediatric. That's really the only other one. And then the nutrition support one is it's a joint certificate. So it's done through another organization called Aspen. And it's also all online. It's once you're a practicing dietitian in a clinical setting. It doesn't so a lot of the certificates through that that my panelists mentioned require a certain set of practice hours. So you can't just kind of get your RD and then off the bat apply to be credentialed in sports nutrition or pediatric specialty or anything like that. We have to document a certain number of practice hours and have those signed off. And then for the nutrition support certification, it's basically, it's the same test that you take if you're a pharmacist or an RN or an MD that wants to be certified in the specific area. So it's really just getting the hands-on knowledge and education. And it's almost like a course on its own, but it's like a self-study course combined with your practical experience. And then when you're ready, you sign up for the exam, and passing that is what gives you the certification. But yeah, those are the main ones. And there's always like certificates like that are, like in obesity, nutrition and weight management, that I think also maybe run through organizations joined with the Academy of Nutrition and Dietetics. And that list is always growing. Honestly, I don't really, it's hard to keep up, but there's definitely a lot of specialty areas that you can go in.
There is another question in the Q&A. What is the hardest part of your job?
I don't know. I would say that for me, the hardest part, it really has to be right now in terms of the challenge being predicting the future, which I can't do, and I don't think anyone can, but COVID has changed so much for us, especially in working with in supplements and knowing where it's going to go next and how to best respond to public health needs through supplements in terms of what do we do next is really just the biggest question, and it keeps us on our toes. But on a more day-to-day basis, I think the biggest challenge and difficulty is working with different personalities, especially when you have organizations that are growing or going through a lot of change. There's always different personalities that you have to work with, and it goes back to being adaptable and being flexible and being able to talk to a large number of different personalities and people. So I would say that navigating that is always challenging, but also rewarding eventually.
Yeah, the field of sports nutrition, particularly in the college setting, is still very young. And so just having enough staff and the budget to do everything that we want to do is a challenge for sure. There could be like 10 of me, and there are a couple of us, but more would definitely allow us to go deeper with our student athletes and even customize and personalize things even more. So that's kind of a larger thing, but on a day-to-day basis, you get pulled in so many different directions. And I know personally it can be hard to kind of like focus and leave things undone because you have to go, jump on a different task. So that's like the fun part, because it keeps you on your toes. There's new puzzles you have to solve every day, but it's also very challenging because you have to wear a bunch of different hats at the same time.
I just want to thank you again for being here today. It's 5 o'clock. I don't want to keep you beyond what I promised. So thank you so much for being here today. Thank you for the students for hanging around and being here and having questions. So I'm going to stop